The Department of Veterans Affairs is embarking on big changes next year. It's looking to get the rocky rollout of the new electronic health record back on track. VA medical facilities already using the system have been beset with problems for years. Meanwhile, the VA is planning to roll out the biggest reorganization of its healthcare operation in decades. Federal News Network's Jory Heckman is here with more. Jory, 2025 had a lot of changes. 2026 is going to bring more. You cover the VA on a regular basis. What are you looking at?
So first things first, the Veterans Affairs Department, they are looking at getting its rocky rollout of an electronic health record back on track. This has been a persistent problem across multiple administrations. This is a contract that was actually signed in the first Trump administration. And what we saw in recent years is that this new system, which is built by Cerner and now is part of Oracle bought the company some years ago, it has been a struggle for the facilities that have been using this system. In fact, since April of 2023, the program has been on a reset, meaning that there are no new go-lives of the system at VA facilities, and it's been on pause contingent on these facilities showing improvements in productivity, basically getting back to where they were before the go live in terms of productivity, in terms of user satisfaction, in terms of results of delivering healthcare to veterans. It's been a situation where both parties in Congress have been very concerned about this project. It has been ballooning in cost. It's a multi-billion-dollar project. And for what it's worth, the DoD has actually completed its rollout of the same EHR. The whole point of this is that it would be interoperable between DoD and the VA, and that service members, once they leave active duty military service, that they would have their records available to the VA and it would be seamless in terms of that healthcare. But at this point, VA is encountering many more problems than what DoD ever encountered.
Well, I hope they're taking all of those lessons learned into the future. What does the plan for EHR look like going forward?
So at this point in time, the VA is looking at going live at 13 new sites in 2026. This is going to first focus on 4 sites in Michigan. And what we heard recently from Dr. Neil Evans, he's the acting program director of VA's Electronic Health Record Modernization Integration Office. He says that these are actually going to be simultaneous go-lives. It won't be this sequence of one after another after another. Here's what he had to say at a recent House VA committee hearing of the Tech Modernization Subcommittee.
This approach allows us to scale up the number of deployments, enhance efficiencies, and improve the sharing of best practices within and between markets.
So that was Dr. Evans talking about the path forward here. It's worth pointing out that the Government Accountability Office is concerned about this simultaneous go-live approach. They say that it introduces more complexity to a project that has already been beset with problems, and that they say that this raises concerns in terms of whether it will work out the way that VA intends.
So GAO has concerns. What do lawmakers make of this plan?
They are just as well concerned. We heard from the chairman of the subcommittee, Tom Barrett. He is representing a district in Michigan, so he has very vested interest in how these go-lives go in his state. There's kind of a split feeling about all of this, where at some point, lawmakers want this project to be complete. It has been stalled, and they've been throwing a lot of money at this project for not a lot of results. But at the same time, lawmakers are equally concerned that this is actually a system that delivers better outcomes for veterans, because there have been instances where veterans have been harmed from this EHR situation. There have been pharmacy mix-ups. There have been instances that Congress acknowledges where this has resulted in the deaths of veterans. It's contributed to those deaths in some way. Here's Barrett spelling out some of the concerns that he and so many other lawmakers have.
This timeline is locked in and the countdown is on, but the question remains, when the switch is flipped in April, will the system deliver and will it do what we need it to do? Or are we going to run into snags like we have in the past? For millions of veterans relying on VA hospitals and staff supporting them, this is not something that is theoretical. It's real, it's happening, and we have to do it right.
Well, the EHR itself is a huge task, but what other reforms is the VA looking at for 2026?
Yeah, so in addition to everything we've been talking about, the VA is also embarking on a major reform of the Veterans Health Administration. This is the largest shakeup of VHA in decades. What this is going to mean, we haven't gotten a lot of details on just yet, but what we do know is it's going to reduce the number of Veterans Integrated Service Networks, or VISNs, from 18 down to 5. VISNs are these kind of multi-state groupings of the greater United States, where they are regional hubs where they address regional needs of veterans. And so that's going to be shrinking. One thing that VA Secretary Doug Collins has mentioned here is that this is a reform that is not going to result in the workforce at VA being cut. There's some things worth pointing out as far as caveats. VA this year did reduce its headcount by 30,000 positions. VA managed this entirely through voluntary separation incentives. There were no RIFs as the VA initially contemplated. But it is worth pointing out internal documents that I and other outlets have obtained suggest that the VA is actually going to be not filling some of its vacant positions going forward. The VA, as agency watchdogs and GAO has documented in the past, always deals with an acute shortage of some VA medical positions across its network. There's always more people than they always are in need of certain positions that are essential to healthcare delivery. And so VA in some way is saying that they don't need to hire as much as they have in the past. In fact, they're going to let some of these positions remain unfilled. Collins in the past, however, has been adamant that the headcount of VA doesn't necessarily translate into its results for veterans, that it can still meet its healthcare mission without necessarily raising the overall workforce size.
Jory, VA is one of the few agencies that currently has a 2026 appropriation. What are you hearing from Capitol Hill about their concerns and their interests at VA going forward?
So VA is a big place. It's the largest agency behind the second only to the Pentagon. And lawmakers that have a oversight duty for VA, they have been contemplating how they can get more oversight and a stake in how the VA operates. And so just recently, a number of the top Republicans and some Democrats on the House VA committee, they have proposed basically an NDAA for the Department of Veterans Affairs, where they would reauthorize certain programs. That's something that has not really happened in quite some time. These programs just kind of, once they are created, they exist in perpetuity, and then there are hearings about whether they are successful or not. And so House VA Committee Chairman Mike Bost is leading this effort along with some of his colleagues. This idea that lawmakers are able to take a closer look at what's working, what's not, and if something's not working, whether they need to reform it in some way, whether they need to pull the plug on it and divert those resources somewhere else. These are basically what the lawmakers are trying to accomplish here.
Sounds like there will be a lot to watch in 2026.
No doubt.
That's Federal News Network's Jory Heckman. You can find his story at federalnewsnetwork.com.